many people believe in physician-assisted death or dying with dignity? Okay, so about less than half. Did you know that Maine has become the 8th state to legalize physician-assisted death, along with other states holding similar laws? Anybody? No. So my stepfather suffered the last year of his life. Sepsis paralyzed him in 2017, along with respiratory issues. His combination of health issues was lethal. He would comment that he would prefer to die as he had to learn how to walk again. On October 4th, 2018, he passed away unexpectedly alone at home, leaving us grieving. My name is Tabitha, and today I'm going to talk about legalizing physician-assisted death. At the end of my speech, I will ask the group to sign a petition. Some disabilities cause them to desire death. That's according to PBS. People are dying and suffering terminal illnesses. It's a problem because it causes undue grief and suffering on the patients and the families knowing their loved one is going to die due to an illness. In addition to the ill loved one feeling remorseful for such illness as well. On November 2014, Brittany Maynard, a 29-year-old suffering from terminal brain cancer, took a lethal dose of prescription pills and died surrounded by loved ones. Dying with Dignity Acts or similar laws have passed in California, Colorado, Hawaii, Vermont, Washington, New Jersey, and the District of Columbia. Opposers would say that the Dying with Dignity Act is a sin, and it considers it along the lines of murder or suicide. Stop keeping the body alive with machines and honor the patient's decision to live or die. USA News Today. Terminally ill patients are being kept alive by machines or prescription drugs. For others, insurance does not cover much needed therapies or medications, leaving them to suffer even longer. Some people would agree that by not passing a Dying with Dignity law is denying their loved ones one personal liberty. Many opposing this law has pursued legal action against physicians, while other countries permit physician-assisted death. An example is in the Dutch system. It respects the relationship between an individual doctor and a patient, and it recognizes that mental illness can be painful and debilitating. That's according to The Atlantic. Legalize physician-assisted death or a Dying with Dignity Act in your area. People that are terminally ill will be given the personal liberty of having family around at their time of death. It will also lessen the grievance process as it creates a time for closure amongst loved ones. Opponents say such policies put terminally ill people in danger of abuse. Matt Valieri, an executive director of Patients' Rights Action Fund, says that it puts the most vulnerable people in society at risk for abuse, coercion, and mistakes. The Die with Dignity Act passed in Maine states a terminal disease as one that is incurable and will likely end in death within 6 months. I call everyone that people that are terminally ill will be given the personal liberty of having family around at their time of death. Help Arizona become the next state to pass a Dying with Dignity law. Give the patient suffering from terminal illnesses the option to choose. Protect the rights of the patients by signing the petition and assist others in ending their suffering. The taboo of physician-assisted death perceived as suicide or homicide needs to stop. Legalize Dying with Dignity in our state. Give the patients back their rights, and sign my petition. Any questions?
That it?
Yes, ma'am.
How many slides did you have? Okay, ready?
Do I sit down?
What, honey?
Do I do it sitting down?
No, going up.